Hi, everybody. Welcome back to Let's Make a Better World. I'm your host, David Tear, and this video is my fifth in a series of how I think we can really make America great again. And one way we can do that is to improve our healthcare system. And it doesn't take much research to see that our healthcare system is broken. Here's where we rank among 11 countries, 11 developed countries in the world and healthcare ranking. You see we're last on this list. And there's other indications of how bad we are. Life expectancy, as you can see from this table, our life expectancy in 2021 was just 76.1 years, and every other country on this list had a life expectancy over 80 years. So, pretty bad. Uh, and you can see it a little more clearly if you look at this graph here. Look what happened between 2019 and 2021. Our life expectancy actually in 2019 was pretty high. It was 78.8, and but then it dropped sharply over the next 2 years, mainly due to COVID-19. Um, we really didn't handle COVID-19 well in the USA at all. We weren't quarantining people the way we should have. Trump didn't make it an issue at all. He said it was just going to go away. It didn't. Obviously, we had to wait until we got a vaccine for it. I think it has gone up since then. Good news is if you look historically, this is a graph of life expectancy in the United States since 1860. Look at this. I mean, 1860 was only 40 years. It was a sharp drop from the Civil War. Terrible war. It took a terrible toll on Americans. It actually dropped to 35 years by 1865. But it was around 40, late 19th century, started gradually going up. And it's been on an upward trajectory ever since the 19th century. All throughout our history. And this is true for the whole world, too. And this is mostly due, I guess there were two big things that gave us a higher life expectancy. One was better medicine, better medication. We've cured a lot of diseases since the 19th century. Not only that, but we have much better sanitation now, too. So that's the reason life expectancy higher. But this is a worldwide phenomenon. And yeah, I mean, it's close to 80 now, but it is going down in the U.S. And like I showed you earlier, it's over 80 and a lot of most other developed countries around the world. So why is it so bad in the USA? Well, it's not that hard to see why. I mean, look at this. Look, here's a map of the world map, and these green countries on this list are countries that have universal health care. Almost every country in the world has universal health care. Just about every developed country, at least. Uh, so the green countries have free universal health care for everybody. Covers every disease. Blue ones don't cover everything, but they're free for what they cover. So they're not quite as good as the green ones. But red, there aren't too many countries that are red. I mean, the United States, and then a bunch of countries in Africa, which are dirt poor, obviously, and a couple countries in the Middle East, and I guess Indonesia. These are all, I mean, besides the USA, these are all third world countries. And, it's crazy, I think, that the United States doesn't have universal health care. Uh, most developed countries got universal health care a long time ago. As a matter of fact, FDR, Franklin Roosevelt, towards the end of his presidency, one of the last things he wanted to do, he wanted to make another New Deal. He already made one in the 30s that helped us get out of depression, but he wanted to make another one that would make USA have universal health care as a right. Unfortunately, he died before he was able to do that. And I guess no president since has tried to do that here in the USA. And I just think that's terrible. And so we've paid a toll for not having universal health care. I mean, here's some more graphs. Here's the risk. So the problem is that we need health insurance to get good health care, and not everybody has it. I mean, the good news is, I guess, if you look since the 1940s, the percentage of Americans that have had health insurance for a long time went up. So these bars show the percentage that didn't. In 1940, it was actually like 78% of Americans didn't have health insurance. But by around 1980, it went down to about 15%. But since the 80s, it's been going up again. I think that's because of health insurance costs. I mean, a lot of Americans can't afford health insurance anymore. And it's not just bad for people who don't have it. It's bad for people who have it too. I mean, our health care system is really bad. Even people with insurance aren't getting good health care because they have to pay an arm and a leg for their health insurance. Not only their health insurance, but for drugs. Here's pharmaceutical costs since 1978, and you can see from this graph, 1978. People didn't have to pay practically anything for their medicine. Now look what they have to pay. This is the total prescription drug expenses in billions of dollars. I mean, I guess this doesn't show per capita, but look at this: over $600 billion Americans are paying right now just for prescription drug. Well, this is projected to 2026, but it's around 500 billion nationwide, and you know. Here's another graph. So this is the average price for prescription drugs. Look at that. People are paying $250 for prescription drugs. I think per year. I don't know what the period is, but then generic drugs are much cheaper, and these are actually getting cheaper. I think these are adjusted for inflation. So now you pretty much have to get generic drugs to deal with whatever diseases you have to take drugs for. And I don't know. I mean, I think, and here's just one last thing I want to show you: the advantages of PPOs versus HMOs. And HMOs are really bad, and I don't even know why we have them. I think it was Nixon who started the whole HMO system. It was kind of a way of having people. It was a way of kind of privatizing medicine. And, I mean, everything's becoming privatized here in the USA. And I think medicine is the last thing we want to privatize. I mean, this should be a right for everybody. I mean, as a society, we should make sure that everybody is healthy and not have terrible diseases. And I think that should just be a right, that healthcare should be a right, in my opinion. Just like food, clothing, adequate food, clothing, shelter, and education. I think those are basic needs that I think anybody in a developed country, a rich country, should have all those things provided for. And of course, we have to pay more taxes for it, but the whole rest of the developed world does this with universal health care, and I don't know why we can't. So I just think that's something that we really need to do as a nation to, universal health care. So anyway, that's my talk. I hope you enjoyed it, and I'll see you next time.